Good evening and welcome to New England Newsmakers. I'm Sarah Zapp. Let me start with you a little bit. What, yeah, you know who that is, right?
I sure do, huh?
Let me ask you a little bit. At what point did you start to think something's not quite right, isn't quite developing the right way?
When he was about 2.5, he really wasn't speaking much at all, just making a lot of baby sounds. And we got him into the early intervention program at that point, which really didn't do a whole lot. At 3 years old, the kids transitioned out of early intervention and they transitioned to the school department. So that's what happened to us. We transitioned. It took them a good 9 months before he even started receiving any speech therapy.
So at this point it was just speech therapy, not necessarily through the program.
Right, not at all. We hadn't met Dr. Pedro yet. We just found him in about February of this year.
So what did you think when you first saw Jared, aside from the fact that he's just cute as a button?
Cute as a button. Well, he was very similar to many out of the other speech pathologies we've had. We've had an enormous amount of experience with very difficult speech cases, and it was just typical.
So start to explain for people at home wondering exactly how this works. How does your approach work when you see someone like Jared walk in your front door to actually help them progress without using medicines or a surgery?
Well, what we do is we start to look how the brain functions, and as we began talking about, we look at his eye movements, and his eye movements will be a clue for us to see how different areas of his brain are functioning, and we look at how they integrate with the areas of speech and language and memory, etc. And we do that by having a different tool or instrument to evaluate each lobe of the brain and each hemisphere of the brain. And then we become very exacting in how we triangulate what in the nervous system isn't quite right for the individual patient.
Patty, what did you start to see after you had seen Dr. Pedro and start to see the approaches that he used?
After, I would say, even just a week or two, all of a sudden he started making a whole lot of new sounds.
Huh.
The few words that he did say suddenly were a lot clearer than he used to say them before. And as I've told Dr. Pedro, if it was just me that noticed it, I would think it was just the mom thing, seeing what I want to see. But his teachers have noticed it, his speech therapists noticed it, his babysitters. Everybody noticed he's making a lot more sounds and getting so much closer to words.
What did you think when someone said, we can help your little son, but we're not using any medicine, you don't have to send him into a hospital for a procedure?
I was thrilled. I happened to see a program on television that somebody did on Dr. Pedro, and I saw it at 6 a.m. on a Sunday morning, and I woke my husband up and I said, I found a doctor that can help Jared. And my husband thought I was nuts. He's like, Patty, go back to sleep. And we ended up going to a presentation that Dr. Pedro did, and he explained exactly what wasn't happening, what wasn't making the connection. And no one had been able to tell me why he didn't speak. Dr. Pedro told me why and how he could fix it.
So how could you fix that? How do you begin to fix that? What is it that actually does the fixing if there aren't medications or procedures?
Well, the first thing we look at is to see if all the connections are there. Very simply, if all the wiring is there, if you will. And if it is, then what we go about is figuring out what sensory integrative techniques or modalities or methods we can use to amplify the signal from one area of the brain to the other. So if the criteria number one is, are all the pieces there? Is the wiring intact? And if it's in place, then we can utilize that to amplify its effectiveness and its efficiency, and with repetition, repetition, repetition over time, it actually builds a stronger pathway.